Hello and welcome to the Telegraph studio. I'm Alistair Green and today we're discussing the role of pharmacies in the health environment. And joining me is Cormac Tobin from Lloyd's Pharmacy. Good morning.
Good morning, Alistair.
Now, we're very aware today of the pressures on NHS, such as waiting times for GP surgeries, A&E and so on. Why are these increasing?
We have a crisis on our hands, and we need to understand that outside of the A&E and doctors, there are 14,000 pharmacies available to help people with their minor ailments and their medical needs. Human beings have a gene that when they're born, if they have a medical problem, they go straight to a doctor or straight to an A&E, which is putting tremendous pressure on the system. But we in pharmacy believe we have a phenomenally educated workforce who can give an alternative. It's a trusting workforce, it's a knowledgeable workforce, and there's 14,000 locations available on a daily basis.
So you're talking about everyday people who care about their health. You mentioned GPs, the NHS, pharmacies and so on. You know, what can actually be done to relieve this pressure?
Simon Stevens, a very exciting leader in the NHS now, has outlined a 5-year forward view. And to me, this is hugely significant. It gives clarity over what the NHS are setting out to achieve over the next 5 years, integrating many parts of the healthcare industry. And clearly outlines the need for more primary care and linked up care in the community right across each element of what can be provided. And we are very excited about this. This is a real statement of the NHS's intent to have a NHS healthcare fit for future needs.
But you're talking about a massive attitude change that people are going to have to undertake. Now, we're very aware of the prevention campaigns and things, but what are we going to be able to do to change people's attitudes when it comes to medical care generally?
You're right, we need to tackle this seriously on. As I said before, people have a gene. I have to go to the doctor, I have to go to GP, I have a problem. And educating that is going to be tremendously important, starting at a young age and educating people, utilising technology and utilising the industry itself to change the way it works. Because some of it is a protectionism of things from the past and not being able to let go. So a massive education right across the industry itself and the public to engage with change and accept that change is going to be very important.
Now, you say the public there, and you hinted on the industry, but actually that's a major part of it, isn't it? I mean, what are they going to do, you know, in terms of the pharmacies, the NHS and so on? What role are they going to have to play in these changes?
We have to work together to educate people. The whole industry has to engage with each other and say, okay, I'm not precious about my area of the healthcare. I'm willing other areas to take on that challenge so I can be released to do more specialised areas. We can take some pressure off the GPs and help them focus in on really difficult needs of patients. We can manage them in other ways that is much simpler and more convenient through technology or in their local community.
Now, you're talking about big changes here, which is going to affect everybody from the pharmacies, the NHS, the general public. Whose responsibility is it to actually bring in these changes and make them effective?
I think leadership must come from our government and the NHS. That's where it starts. Once these people set about a plan, as is in the 5-year forward view plan, they must be convicted to deliver it in a certain time frame. And we have 5 years to work together. Their job is to engage with ourselves, GPs, specialists in the industry and decide how to execute it at a local level to give the best outcomes. But this must be done speedily and with clear focus.
I mean, it all sounds very nice, but obviously let's look at your role as pharmacies. A lot of people would actually say, are you really qualified to deal with patients?
Absolutely. In our company alone, every day, 1 million patients cross our doors to look for advice, help and their medicines. Pharmacists go to university for about 4 years to be educated and then to arrive in retail outlets and possibly doing a lot of box moving. They have been an underutilised resource in the healthcare system because old technologies have meant they've had to do their job a certain way. Most companies like ourselves are introducing modern technologies to take the mundane work out of that and movement of boxes and freeing up their time to engage in medicine management with patients, to engage with adding new services, to engage with adding help with pain and minor ailments. And we believe we are strongly positioned now with over 14,000 outlets to provide minor ailments to the NHS and alleviate the pressure from the A&E departments.
Okay, so let's talk about how you can alleviate that pressure. How can pharmacies play a bigger role?
An example would be we are running pilot A&E clinics in our stores called First Care Clinics. And we have trained and worked with commissioners to skill our people up to deal with minor ailments. In these communities we're doing it, we're having huge success, where people now, through our marketing and working with the local trust, are going to our stores to get minor ailments and get their assistance there, get some clinical advice, and then we can forward them on to doctors if required, or to A&Es if it's a more serious condition. And that's alleviating pressures very, very quickly off A&E departments so they can deal with the big issues.
So you're talking about we there, that's been Lloyd's Pharmacy. So what are the sort of things that you're coming up with that has a direct impact on helping the NHS?
Well, one of the big things we've done in the last few years is we've done diabetes screening. And we have screened over 1.5 million people for diabetes. Diabetes is a crisis for the healthcare industry. It brings many, many difficulties to it. But we believe our role in Lloyd's Pharmacy is to screen as many as the public as we can. We've also opened one of our First Care clinics in an A&E, where people are triaged to the main A&E or to ourselves in our First Care clinic, where we can deal with minor ailments and advise people. And that is working very, very well. And they're just two of the ideas we have in sort of play at the moment to alleviate pressure.
What actually does differentiate Lloyd's from all of those other brands that we see up and down the high street?
I think Lloyd's, the big differentiation for us is the fact that we have an end-to-end company. We're not just in pharmacy or in distribution. We're not just in looking after our independent customers. We have a doctor online. We have many, many solutions to offer an ecosystem around the needs of our customers. And our customers are our independent pharmacy companies we deal with. They're our customers in our stores, and they're patients at home. And we have a strong thinking about building intimate relationships with patients of trust, and where they know they can get reliable help and they know that the outcomes will be better than anywhere else. And we believe that distinguishes us and differentiates us in the marketplace.
A word you've used earlier on was future. Let's take a look into the future. The pressures are only going to grow on our NHS and the whole healthcare industry for all the reasons we know about. How optimistic are you about the way it's going to work in the future?
I'm feeling very optimistic because the NHS is a treasured institution. It is probably one of the best healthcare institutions in the world. The 5-year forward view to me is very, very significant. The second thing is saying technology will play a huge role in assisting healthcare in the future. Those statements from our leadership in the NHS and government give me the confidence that we're on a path. It's going to be fraught with danger, it's going to be difficult, but we have a responsibility to educate, tell stories and bring people on this journey. Because to me, there is great leadership in the NHS. It is now beginning to show that it can execute strategies, and I'm confident that we can deliver an NHS that's stronger, that's fit for purpose for the future, but also that utilises a whole community aspect of healthcare through the 5-year forward view.
Well, thank you for giving us a glimpse into the future of healthcare. Tobin from Lloyd's Pharmacy, thank you very much.
Thank you, Alistair.